I think people's mental health can have a significant impact on their financial health. Mental health can totally change how you view your financial life, and unfortunately for me, I've had to deal with a lot of clients that are really struggling. I've had a lot of clients commit suicide, and that's something that's pretty personal to me. People can't see mental health problems. It's all they see, oh, you broke your arm. I can see that you broke your arm. When your mind is broken, that's even worse because it's so debilitating that you physically cannot do anything to help your situation. I had an attorney, I was an attorney one time. Attorneys really, really struggle. She had a baby and she had postpartum depression. And because she had postpartum depression, she didn't file her tax returns for her law firm. She filed them late, she paid them late, and the IRS assessed her a huge penalty. And it's like, we need a system for dealing with that. Like, if you were mentally incapacitated to the point where you were checked into a hospital, there should be a solution for that. And what was really frustrating to me when dealing with the government in that specific case was when I filed the penalty abatement request, they said, you know, I'm not sure if this meets reasonable cause. And there is one for mental and physical health. But the fact that I had to go so far to prove it to them, that was so frustrating to me. I had another one where it was a doctor, and she had been physically abused, she had lost her baby, and she didn't pay her payroll taxes. And the government was like, well, you know, she should have found someone to file and pay her payroll taxes. I was like, yeah, I think that's an unreasonable response, right? She's the only one in her business. She could have found someone else to run her business for her. It's like, clearly you do not understand how bad mental health, and then add the physical abuse and the trauma that this woman was going through. And they're like, well, she's a doctor, she could have figured that out. You know what? Mental health doesn't pick people based on socioeconomic. They don't pick it based on race. They don't pick it based on, you know, how much money you make, what your social status is. It can affect anybody at any level. And so for the government to be so aloof about it, just, well, she should have picked someone else, that was really unsettling to me. And I think that's a problem with bureaucracy, is like, people are human. People are gonna have issues like that. And I have to advocate for those people.